You've all experienced it. There's a problem with your healthcare bill, or you have difficulty getting coverage for the care you need. Your doctor or hospital tells you to talk to your insurer. Your insurer tells you to talk to your doctor or hospital. You're stuck in an endless runaround. The small patient advocacy industry has sprung up to help, but that help can cost several $100s an hour. Is there a way to get the customer service we deserve? That's the topic of this week's Healthcare Triage. Special thanks to Austin Frack, from whose Upshot column this episode was adapted. Some kinds of health insurance plans provide better customer service than others. Among those that do are plans offered directly by hospitals or health systems, according to results from a recent study by Austin, Garrett Johnson, and Zoe Lyon. Their conclusions are based on an analysis of Medicare Advantage plans, private insurance alternatives to traditional Medicare. Medicare Advantage plans are often offered by major insurers like United Healthcare, Humana, Aetna, Blue Cross and Blue Shield affiliates, and others. But nearly 1/4 of the plans are issued by hospitals or health systems. These provider-offered plans are more likely found in dense urban areas in the Northeast and the West. The government collects data on healthcare quality from surveys and medical claims, then aggregates them into ratings of plans. These are publicly reported in units of stars. 5 stars represents the highest quality, and 1 the lowest. Plans offered by insurers have average ratings of just over 3.5 stars for both non-drug and drug service. An average provider-offered plan has quality ratings that are about 1/3 of a star higher for both, after adjusting for factors that could confound the comparison, like socioeconomic status and the types and number of doctors where plans are offered. Their study, published this month in the health policy journal Health Affairs, found that provider-offered plans have higher quality ratings. For instance, measures of preventive screening, like that for colorectal cancer, or management of chronic conditions, assess the quality of care delivered by doctors and hospitals in a plan's networks. Provider-offered plans perform somewhat better than insurer-offered plans in such areas. Other aspects of quality pertain to customer service. In measures of complaints, responsiveness to customers and the enrollee's overall experiences, provider-offered plans really shine. In each area of customer service they examined, provider-offered plans are rated 1/2 star higher than insurer-offered ones. This is a big difference. For comparison, over half of plans are within 1 star of each other in overall quality. These results make some sense. When a customer has an issue, like a problem with a hospital bill, the easiest thing for a health plan to do is pass it off to the hospital. Likewise, the hospital's easiest course of action is to blame the health plan. The patient, stuck in the middle, is not likely to rate his plan or hospital highly for customer service in that case. However, when the plan and hospital are one and the same, neither can pass the buck to the other. Problems may be resolved faster. They may be less likely to develop in the first place. This could lead to the higher customer satisfaction reflected in the quality ratings. If the higher ratings are enough to interest you in trying a provider-offered plan, how would you find one? Unfortunately, there's no readily accessible source to inform consumers or researchers about this feature of plans. Sometimes the plan's name gives away the relationship, though. The UPMC health plan practically has the health system that offers it right in the name. UPMC stands for University of Pittsburgh Medical Center. In other cases, consumers can identify the relationship on plans or health systems' websites. For example, the Vital Traditions Plan website identifies its parent company, the largest nonprofit hospital system in Texas, Baylor Scott & White. But in many cases, it's not so easy to figure out. In fact, this is why there's been so little analysis of provider versus insurer plans. For this study, Austin and his colleagues had to scroll through hundreds of websites, news articles, and documents to build a research data set on provider-offered plans from 2011 to 2015. Because of the work involved, there are very few studies on the subject. Another, published in Health Services Research by Austin, Roger Feldman, and Steve Pizer, found a similar quality relationship when looking at 2009 data. That earlier study also found that provider-offered Medicare Advantage plans charge higher premiums, but a recent study of marketplace plans found that provider-offered ones are not necessarily the most expensive. For some, a higher premium may outweigh the benefits of greater quality, but for others it may not. From their study, they can't be certain that provider sponsorship of plans causes higher quality. Could be that higher quality providers are the ones that choose to offer plans. Nevertheless, such tight integration between plans and providers is at least a signal of higher quality, even if it doesn't cause it. Recent trends suggest more health systems are offering plans in other healthcare markets for the working age population, not just in Medicare Advantage. Not all markets may be hospitable to provider-offered plans, however. Some systems that did offer plans are pulling back. According to the Wall Street Journal, Catholic Health Initiatives, which runs over 100 hospitals across 18 states, is divesting itself of some of its health insurance plans. After struggles with profitability, Tenet Healthcare and several other health systems have said they're going to do the same. Provider-offered plans may increase convenience for consumers, but the financial risk it confers on the organizations that offer them may be more than some can handle. Healthcare Triage is supported in part by viewers like you through Patreon.com, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank our research associates Joe Sevitz and Jonathan Dunn, and of course our Surgeon Admiral Sam. Thanks, Joe, Jonathan, and Sam. More information can be found at patreon.com/healthcaretriage.